So bedwetting, which is also known as nocturnal enuresis, is something that can happen to kids at lots of different ages. It's not just as kids are learning to control their bladders. So it can be caused by a lot of different things. One of the things is just delayed bladder maturation. So some kids their bladder matures a little bit slower and they don't have such strong cues. Another thing that can cause it is deep sleepers. So if your child is sleeping really, really deeply and that like urge to go is just not stronger than their sleep, then they're going to kind of sleep through it. Another thing is constipation. So check out the video that was posted yesterday about constipation. But basically, if there's a lot of stool in the rectum, it can put pressure on the bladder and cause some bedwetting. There's a bunch of other things too, like hormonal imbalances and genetics and stuff like that, but pelvic floor dysfunction is one of them. So again, very similar to constipation. If your child has some muscle imbalances, either the muscles are too tight or they're too weak. Again, constipation, and then also changes in like how often they're going during the day. So if you're having them do a lot of like go to the bathroom before we leave the house, go to the bathroom before we leave for the store, things like that, then you're changing the body's natural reflexes. And we want to have as much of a schedule as possible so that we're going in a consistent pattern instead of just going as often as we can, so that the brain kind of learns when to go. There's a lot of different things that can be worked on in pelvic floor physical therapy sessions with kids to improve the control of their pelvic floor and the control of their bladder, and improving toileting mechanics, things like that, to make sure that they're able to make it through the night.